At Sakra World Hospital in Bangalore. We have with us Dr. Somyaa Khuller, consultant general surgery and minimal invasive surgery, to discuss all your queries on advancements in hernia surgeries. Hello, doctor. Here are a few questions from our followers that are there on advancement in hernia surgery. Can you please explain the recent advances in hernia surgery techniques compared to the traditional methods that we have known for many years?
Yeah, so Dr. Christina, it's like, as you know, as you're also a surgeon, so you do understand that in hernia, initially there used to be only open repair. Then with the advent of minimally invasive surgeries, laparoscopic came in vogue, and that gave us an immense advantage of being able to do the same repair with smaller cuts and hence lesser chances of mesh infection. And now the latest advancement is actually called as robotic surgery, which is a kind of minimally invasive surgery in which the robotic instruments will go in. And these are literally like having miniaturized hands inside the patient abdomen, which are trying to do the same kind of work with greater precision. So, in fact, if you see in the last decade, hernia surgery per se has undergone a sea of change. There has been so much advancement in trying to understand not just how to deal with a simple hernia, but in understanding of the whole disease, where we understand that it is now more of an abdominal wall reconstruction. Bigger hernias, loss of domain hernias, recurrence in hernias, and when there are complications, how to deal with them. So these are the advancements which I would say.
And can you please tell us on how minimally invasive procedures will benefit the patient in terms of recovery and in terms of post-operative pain and discomfort?
Actually, a lot. I mean, we have seen in our practice also that in minimally invasive surgery, the cuts are very small. Hence, the pain is very less. The recovery is way faster. In a certain kind of hernia, like in a very big hernia which requires abdominal wall reconstruction, earlier with open repairs, the patient would stay for 7 to 10 days with drains and everything coming out of their abdomen. Now, with lap or robotic hernias, these kind of patients can go home within a day and there are no drains. So it's very fast recovery, it's very good recovery, the pain is much lesser, getting back to work is much faster. And as again I said, the chances of mesh infection or complication is lesser.
Can you tell us how robotic plays a role in hernia surgery at this age, and how it differs in giving surgical precision and in recovery for the patient?
Yeah, so it's probably the latest use of robotics which has come into vogue. Initially, robotics used to be used only for cancer surgeries or prosthetic surgeries, gynec surgeries. But now, since the past few years, we can say that hernia repair in robotic surgeries has actually come up in a big way, because we can see a huge amount of advantage with the quality of life that the patient has, with the quality or the robustness of the repair that we can do, and the fact that we can place the mesh in between the layers of the abdominal wall rather than inside the abdominal wall. Now, placing a foreign body or a mesh inside the abdomen actually has its own pros and cons, as you know. It still has to be done in certain conditions, but it's always better to be placing it in between the abdominal wall layers. It's more physiological, means more natural. So when it comes to robotics, it has really changed this whole outlook towards doing advanced hernia repair, where now you can place the mesh in a more physiological way, have a more robust repair and very precise repairs. Hence, obviously, the recovery is much faster.
Yes. And we know over the years, polypropylene mesh has been used for the hernia surgeries. Are there any new meshes that have come into the market right now which can offer better long-term results?
Yes, so polypropylene, even though has been there for a very long time, it's actually the standard, the gold standard, I would say. Again, depends on the area that you put it in. If we are putting a mesh inside the abdominal cavity, it's kind of a special mesh. It needs to have a lining over it so that it does not damage the intestines and that when the intestines come in touch with it. So there are techniques of doing that, and these meshes are definitely coming at a higher cost. In fact, nowadays there are bioresorbable meshes also, which are basically mesh which stays for a certain amount of time till the scar plate is formed, which is what we need for good hernia repair. And then later it just resorbs off on its own. Now these are way costlier, but yes, these are there. So there are a lot of advancement in meshes also which has happened over a period of time. In inguinal hernias now, we have something called as 3D meshes. As you know, the pelvic anatomy, inguinal hernias are the lower abdominal hernias. So the lower abdominal anatomy is not like a flat area. When you place a mesh, it's not over a flat area. So now the meshes are coming which are contoured to the body shape, and this sits much better. Hence, there are no need of fixation, lesser pain, and the lesser chances of recurrence, I would say.
That is well explained, ma'am. So we do see a lot of primary hernias in our clinic. Compared to those primary hernias, how would you differ in operating or preparing a patient with a recurrent hernia, that is a recurrence after a abdominal surgery done for some other condition, or a complex hernia, even if it's a primary hernia?
Yeah, so first I think the viewers need to understand what is a primary hernia. A primary hernia is basically a hernia or a hole in the abdominal wall, to be in a, simpler terms, which happens when there has been no intervention done to the abdomen, no cuts, nothing, it has just come on its own. An incisional hernia, though, is when you have had a surgery and any one of these small cuts, the weakness will develop, and that's when the incisional hernia will happen. A recurrent hernia is when you have repaired one of the hernias, but again over a period of time, hernias are occurring back again. This is what people are most scared of actually, and they keep on coming and asking me, doctor, we have heard that once you repair hernia, it comes back again and again. That's not true actually. If you plan the repair well, if you prepare the patient well, you understand the factors that can actually cause a recurrence and all that. So all this, what we call in medical terms, is prehabilitation and preparation of the patient before the surgery. The chances of hernia recurrence will come down drastically because you're sort of tailor making the solution to that particular patient. Larger hernia, obese patient, having diabetes, having cough, you control the sugars, you control the cough, you make sure that probably the patient loses a bit of weight, and you plan the particular kind of hernia repair in such a way that your mesh has a wide coverage. In such patients, then it may not, recur. So when it's a recurrent or a complex hernia, the preparation part is more important and takes a very prime place in making sure that the recovery of the patient happens well, not just the surgery.
And so in the preparation that you were talking about, doctor, where would you put imaging into? Do you do a routine?
So by imaging we mean scan, like ultrasound or CT scan. So if it's a small hernia, like thin patient, very evident clinically, maybe an ultrasound would suffice. In fact, hernias are a clinical diagnosis, as you know. We have to touch the patient, see how it is, and then we understand the abdominal wall, the structure. But there are certain cases, especially where in very fat patients or very obese patients, you cannot make out whether that is fat or a hernia. So these are called as obscure hernias. Or in recurrent cases, where suppose you have done a repair, mesh has been infected, you've removed the mesh, again the patient comes to you with hernia. Then you have to definitely make sure that you do an advanced imaging. So something like a CT scan, so that you can understand the muscles, you can understand what kind of contents are going in, what are stuck inside for a safer surgery. You have to go in prepared. That is very important.
Now that a patient, let us assume a patient has undergone a hernia repair, how would the recovery be? When will we discharge the patient, and how is the life after the hernia surgery? What are the precautions that they would have to take at home?
And this is a very favorite question of all the patients. In most of the hernia repairs, I would say, within a day you should be out of the hospital. But in few advanced cases or in places where the patient's factors only mandate us to monitor the patient more, the patient may be in for a little longer duration. Now, again, this cannot be generalized. Some patients have very badly stuck intestines inside the hernia, and these people, if we have to cut the intestines and then join them again, these people will have a longer recovery in the hospital. But as a rule, after hernia surgery, from day one, you should be able to walk, you should be able to bend slightly, you should be able to climb stairs and do your natural, whatever regular activities on your own, except for very exertional activities and lifting heavy weights. So lifting heavy weights is something which I say that more than 10 to 15 kgs, that patients should avoid for maybe around 1 or 2 months. Again, badminton, having tennis or these kind of, or maybe Zumba. These are the little activities which require you to, jump a lot and put a lot of strain on your abdomen. So probably these also can be avoided for maybe 2 to 3 weeks. But if it comes to gentle yoga, walking, or swimming, these can be started pretty much within a week or so, because these are all gentle on your abdomen and they don't cause much of a difficulty. Having said that, one more important thing, driving a two-wheeler in Bangalore traffic is avoided fully for 1 month at least, because you will end up stopping and putting all the pressure on your groin or your abdomen. So please don't drive a two-wheeler immediately. If you're from some other place which has lesser traffic, it's different, but otherwise you need to avoid to drive a two-wheeler. Four-wheeler should be fine, especially because I think most of them have automatics now, so that's okay.
So to summarize, doctor, a patient with a hernia comes to us to the OPD, gets examined by you, gets all the relevant investigations done, and once they are fit for surgery, once we determine they're fit for surgery without any risks, we schedule them for a surgery. They can get admitted the early morning or the previous day night, get operated the next day, and the day after the surgery they can go back home.
Exactly.
And return back to their work by 5 days.
5 days, 1 week, sometimes even 2 to 3 days, depending on their
recovery.
Yeah. Exactly.
Thank you, doctor, for your valuable insights.
Thank you.
Thank you for joining us, viewers. You can leave a comment if you have any queries.
Thank you.